Alright, hi, my name is Josh Brown, and today we're going to be doing an ankle assessment on Joey. Alright, so what I'd start with is I'd ask the patient his pastime, what he does in his free time, basically, what he does for fun, and the types of places he's going to be all the time. Occupation, I'd ask about his job, what he does for a living, what is he going to spend most of his time doing in a day. And then previous history, has this injury happened before? Doing this, we'd be able to narrow down to a few things that might pinpoint the injury exactly, and it'll help us a lot in the long run. Next, we'd ask shoes. Obviously, if he wears flip-flops, that's going to be a lot less supporting than if he wore running shoes. Next, we'd ask about his terrain, like the place he's going to work in, the environment he's going to be in all the time. Factors like that could help us narrow down the injury if he works in like a junkyard based on a soccer field. So much easier to roll your ankle in junkyard. You can step on something, right? Yeah. And then next we'd ask if activities hurt. Does prolonged activity cause you to feel more pain than you would when you were sitting on a table and resting? Right. And then next we'd ask the mechanism of injury. How did you get hurt? Where were you when you got hurt? Who hit you? How did they hit you? When did they hit you? Why did they hit you? Did you piss them off? Did you make them mad? Because that would make them hit you harder. Alright. Next we'd ask the symptoms, if the symptoms change. That's kind of the same thing, in my opinion, as do activities hurt. I feel like if symptoms change, does prolonged activity cause you pain, more pain, as you would feel if you were sitting on the table? Next, boundary of pain, the area of pain. Like, is it going to be down on your shin? Obviously, we ask the patient, where are you feeling pain? How much pain are you feeling? Where does it hurt the most? A good thing to ask is a scale of 1 to 10. Do you feel in your ankle, or wherever he specifies, that pain in that area, does it hurt worse being 1, 10 being, no, opposite, least being 1, 10 being worst? And that's something that's good to ask. And then last, or not last yet, we ask if it's loose or locking. Is your ankle stiff or is it locking? That helps us narrow down a few more things to the type of injury he has. We finally, after that, we'd ask if there's swelling or bruising. We'd look over his ankle just to see if there's any purple areas. And no, you don't have any swelling or bruising, sir. Alright, so now we're going to do the O part of HOPS, our observation. Okay, let me do that again.
How about just understand that it's like inspection is the first part.
Okay.
So inspection and palpation.
So, alright, so now we're going to do the O part of HOPS. We're gonna do our observation, which is our inspection. Alright, so first we're going to have him stand on his toes, and then we're going to check his gait. So now we're going to have him walk. Just walk. Alright. Okay, so now we're going to do the first part of our assessment. So this is the anterior view of the foot, and what we're going to check for is any toe deformities first. There seems to be no toe deformities. He's good there. Next we're going to check his toenails. All look normal. Next we'll check for athlete's foot, just for any cracking or fungus. Looks good. Now we're going to check his anterior tibial tendon. Very good. And then next, spaying of toes. We're going to spread his toes out. Check for any more deformities. Looks good to me. And then next we're going to check his extension tendons. Extend your toe for me. Extend your toes. Everything looks nice. Alright, that's it for the anterior view. Alright, now we're going to do the medial portion of our assessment of the ankle. So first we're going to check his longitudinal arch. Looks good. A little bit low, but very nice altogether. Next we're going to check his deltoid ligaments. Looks good to me. Next we're going to check his medial malleolus, right here. Very good. And then last we're going to check his tibial nerve. It runs all the way up here through his foot. Alright, looks good to me. Alright, so now we're going to do the posterior observation of his foot. So we're going to check his Achilles tendon first. Palpate. Looks good to me. Then we're going to have him supinate. Supinate for me. Good. And now pronate. Good. Alright. Alright, now we're going to be doing the lateral portion of the assessment. So first we're going to check the anterior talofibular ligament, which will be right around here. Looks good. And then we'll check the peroneal tendon, which is or peroneal tendon. We're running down here. Looks good to me. And then lastly, we'll check his arch, which looks also very well. Alright. Alright guys, now we're going to do the plantar view assessment of his ankle. So first what we're going to do is check between all of his toes, which there is some fuzz in between them, but that's just because he wore socks. Next we're going to check for plantar warts, which would be running along here on the bottom of the foot. And it seems to be that you do have a wart on the bottom of your foot.
Do not.
What is that? Nope, that is not a wart. Okay, no. That is just some dead skin or something.
I don't know.
Okay.
I don't look at the bottom of my feet. So
And then we're going to check his sesamoid bones, which would be right around here, just to make sure they're still there. Yeah, he's got his sesamoid bones. I'm going to check his flexor tendons, so what I want you to do is push your toes down for me. Push them down. Good, and I'm going to resist. Now push them down. Good. So there's some strength there. And then next we're going to check for plantar flexion. So all I want you to do is plantar flex for me. Push your foot forward. Very good. Palpate everything. Nice. Alright. And that sums it up for the plantar view of the foot. Alright, so now we're going to do the range of motion test using the goniometer. So what we're going to do is we're going to have him at a 90-degree angle. Very good. So first we're going to have him dorsiflex. Dorsiflex for me. Measure, measure, measure. Alright. He was at about a 20-degree angle. Very good. So now we're going to have him dorsiflex for me after, I bring you back to a 90-degree angle. Good, now dorsiflex for me. Plantar flex for me. Measure. He looks to be at about a 54-degree angle. Next we're going to have him invert for me. Invert. He is at about a 39-degree angle. And evert for me. He is now at a 21-degree angle. Alright, so now we're going to do the muscle testing portion of our assessment. So the first muscle we're going to assess is the anterior tibialis muscle. To assess that, what we're going to do is we're going to have him dorsiflex for me. We're going to have him invert. And what I'm going to do is I'm going to resist that pull or push of him, and you'll feel that muscle right around here flexing or contracting. Alright, good. So now we're going to do the opposite. We're going to do the posterior tibialis. What we're going to do is we're going to have him dorsiflex for me. Now we're going to have him evert. And then we're going to push against him. You can feel that muscle contracting up on his shin. Alright, the next one we're going to try is we're going to do the gastrocnemius. To do that, what we're going to do is we're going to have my foot or my hand underneath his foot, and his foot is going to push down. Good, you can feel that muscle tensing up back there. Very good. Next, we're going to do the flexor hallucis and extensor hallucis longus. What we're going to do is it's mainly on the big toe. We're going to have him push up, and we're going to push down. We're going to fight him as he's pushing up, and we'll feel that extensor hallucis longus right along here. Alright, now dorsiflex, good. Now we're going to have him push down as I push up. And that's the flexor hallucis longus, you can feel that down there. Alright, so the next one, the last one, is a peroneus longus and brevis. And what they're mainly doing is inversion and eversion. So we're going to have him invert as I try to push him to evert. Good. And now do the opposite. He everts while I push him to invert. Very nice. Alright, that is all. Alright, so we're going to do the first of the special tests. So the first one's called the anterior drawer test. And what we're going to be doing... and the table just broke. Alright, so what we're going to be doing is we're going to be checking if any of the ligaments in his knee are torn or broken. So we're going to be checking and making sure that his hammies relax. Okay, good. And then what we're going to do, we're going to pull forward. And if the test is positive, this part should come forward. And as we can tell, Joey does not have any torn ligaments. This time we're going to be doing the apprehension test. And we are on this table because we broke the ping pong table. So patient's leg is going to be at about a 30-degree angle, and for the apprehension test, what we're going to be doing is moving the patella laterally. What this is going to do is we're just going to be able to tell, if there's any dislocated patella. What we're also going to be doing is when we move it, we're going to be looking at the patient's face, this beautiful face, to see if there's any signs of apprehension, or pain, or stress, or if they try to stop you, that's also something bad. So all basically we're going to do is just move it sideways. And Joey does not seem to have a dislocated patella. Alright. So the second one of our special tests is the Varus test. So we're going to be pushing his leg out. So we sit between his legs and we push it out by putting force with this hand, pushing his knee out while pulling in with the other. So all you'd just be doing is pushing it out. Alright, that's the Varus test. The next one is the valgus test. So what we're going to be doing is doing the same thing but pushing the knee in. We pull with this arm while we push the knee in with this arm. So we just push it in. Just push it in. Alright, so for the next of the tests, next of the special tests, we're going to be doing the MTP test, which is really similar to the Varus valgus test, but we're going to be doing it with his toe. Alright, so the first part is we're just going to push the toe inward. That's the valgus test. Hand here, finger here, push the toe inward. Now for the Varus test, thumb, finger, and I push it outward. Very nice, both tests came out negative. Very cool. Alright. So the last of our special tests is the Morton's neuroma test. So what we're going to be initially doing is palpating the third and fourth digit for any inflammation. After we were done palpating, we're going to squeeze the toes together and check for any bumps of any sort. And his test came out negative.